KILDARE Road Medical Centre, located in Blacktown, offers convenient on-site access to a wide range of high-quality medical services, such as allied health services, including a dietitian, physiotherapists, podiatrists, exercise therapists and a psychologist. The team also includes GPs, nurses, radiology, pathology and pharmacy. KILDARE Road has created better patient outcomes through the ability to work as a highly skilled multidisciplinary team and services a significant client base in the Blacktown area.
I'm Yvonne Stanford, Practice Manager here at KILDARE Road Medical Centre. The Medical Centre started in April 2010, so we're just a bit over 2 years in now. We have 16 GPs, 3 specialists, a whole range of allied services, pharmacy, cafe, radiology. We run a skin cancer clinic, a diabetes clinic, so a bit of everything. We have patient education sessions here once every couple of months, free patient education evenings. We run a booth inside West Point Shopping Centre where we have free blood pressure and blood sugar testing for just random people coming along.
My name is Dr. Kevin Bullen. I'm the Medical Director here at KILDARE Road Medical Centre, and my main job is I'm a GP here. Okay, well the practice is made up of 16, 18 GPs. We have lots of allied health in combination with the GPs. We have a fully functional nursing team, which is being developed further and further. We've got a nurse practitioner arriving from the UK soon. So we all integrate, we work well together. We're trying to provide good acute medical care along with preventative medicine and along with taking primary care in Australia into the, well, certainly into the next 10, 20 years.
My name's Peter Rushton, the CEO of KILDARE Road Medical Centre. I was originally working at this particular practice as a pharmacist for 26 years and saw a need to take over the practice and improve the services that were being provided here. Since then, the current practice, KILDARE Road Medical Centre, has been running for 2 years. In that time, we now have 16 GPs on board, 3 specialists, which include 2 general surgeons, an orthopaedic surgeon, and numerous allied health.
From day one, we've always had allied services here. And as we're growing, we're getting more support from more allied services. So now the community's realising and recognising that we're not just offering GP services. Through the Medicare system, if they have a care plan or an EPC plan in place, they're allowed to have their 5 visits, and we've got all of those services here so that they don't have to go searching. It's all here in one place.
And that's where the allied health comes in, because obviously to deal with chronic disease we need all the allied health professionals who can actually complement and help us, so we can provide a more holistic approach to their care. And definitely one-stop shop does sort of fit it in a way. Patients can come here, they can see their GP, they can be referred to the psychologist, they can be referred to the dietitian, they can be referred to the exercise physiologist, which a lot of patients aren't aware of, definitely the physio, the podiatrist.
It always was a focus at the beginning that we would integrate allied health. We realised that there's a lot of jobs that the doctors have to do, and if they could concentrate on other medical issues, then this would make it easier for them. It also creates a good atmosphere within the practice for allied health. They're working as a team, they're collaborating. It also prevents patients slipping through the gaps because you're coordinating care on site for them. It brings a high level of service to the patients. It's also very cost effective. The patients aren't missing appointments. They're followed up, and just for instance, the diabetes annual cycle of care reviews are done. So it's very cost effective that way on the health budget. We now have psychologists, we have physiotherapists, podiatry, exercise physiologists, dietitian and pharmacy just within the practice.
We're not here just to get through patient numbers, we're here for the long term. The long term means improving overall patient care and their actual health. So we look at treating the individual patient health as well as the actual population of our centre and of Western Sydney in the long term, trying to roll out the system that we provide really. That would mean actually seeing patients who do come in with their coughs and colds and things like that, but just as important, in fact a lot more important, to deal with the chronic diseases such as diabetes, asthma, chronic obstructive pulmonary disease, hypertension, depression, all the other ones that roll off the tongue. We
know that within the hospitals in Western Sydney, between 25 and 30% of patients that present would be diabetic. We know we're in an epicentre of major diabetes problems, and so we're concentrating on that. We have a diabetes clinic up and running, which is nurse-led. So this nurse will coordinate through the doctor services that are required. So therefore a diabetic patient could come within this practice, see the podiatrist, see a dietitian, exercise physiologist, then the doctor gets to overview all that. So while the doctor's concentrating on other medical issues, he knows that his patient is being well cared for with the assistance of the health professionals of the allied health. Well, I think we're all human, and we tend to get to appointments when we can. I think having it all coordinated for you is very helpful. Patients also see a large team of health professionals taking their health very seriously. So they have opportunities to speak not just to the GP, but they may raise issues that they haven't have thought of later after the appointment with the GP, and those issues can be relayed back to the doctor if necessary. So they're getting a better health assistance. It's still very early days for us, only being 2 years old as Kildare Road Medical Centre, but certainly doctors have come and shown me the improvement that they've had with diabetic patients in particular, because that's an area we're focused on. But we are now looking at establishing other clinics as we move forward. We're coordinating that into what we see as the major health issues in the community, such as asthma. That would be something that we're very interested in, and so that's the way that we'll be moving forward.
The community loves it. It's a one-stop shop. They also like the fact they can come in, they can see their doctor, and then in the same place where they know the same staff, the same receptionist, they can actually then go and see the other people as well. And that all adds to their holistic care.
The response from patients has been very positive. The feedback that I get when I speak to patients is that they're very impressed and they really appreciate the overall care that they are receiving. WentWest are only a phone call away, and whenever I need any help whatsoever, like at the moment we're going through the personally controlled electronic health records, and WentWest is a major help for that in getting us up and ready to get that started. Any issues that I've had trying to get nurses or any other people on board, I ring WentWest, they're only too happy to help with that. Conferences and all the nights that they run up in their centre, that's all a great help.
I think it's very exciting times ahead of us. We're at the forefront of technology in the practice and very interested in personal controlled electronic health records. We see that as a way of coordinating with other GP practices outside the practice that may want to utilise our allied health that don't have access easily to them. So I think the technology will be the main thing we would see in the next 12 to 18 months as being an exciting way forward.